with Dr. Alex Earl. This is the time I get to spend with you guys and answer all your plastic surgery questions. And we're here at Pure Plastic Surgery today, and we're going to be talking about a very special topic, a topic that's kind of near and dear to my heart, something that I've been a part of and working for many, many years now. And I can honestly say that due to our efforts, my efforts here at Pure Plastic Surgery, we have made BBL safer in Florida and perhaps the world, okay? And so what we're going to talk about today are what are the principles to make sure that you are undergoing a safe BBL, right? So let's start off with a very simple question, right? Or let me start off with two simple questions. Number one, would you rather have a safe BBL or an unsafe BBL, right? You ask that question, everyone's going to say, I'd rather have a safe BBL, right? Question number two, is a BBL worth dying for, right? Who's going to say yes to that? No one's going to say that, okay? So the whole point is you want to have a safe BBL, but on the flip side, there's a lot of wrong information out there in the media, social media, regular media, where they say that the BBL is the unsafest thing that you can do. And that today in 2024 is also completely wrong. If you go to the right person, if you undergo these principles, okay? If you do the right thing, you go to the right person who's doing the right thing, then a BBL can be very, very safe. Actually safer than most other cosmetic procedures. Okay, as opposed to what they're telling you now, where they say like it's the most dangerous cosmetic procedure out there. Well, you know what? That's not for all cases. If you go to the wrong surgeon, it can be. If you go to the wrong place, it can be. If you combine it with multiple other procedures, it can be. Right? So I'm going to tell you what it is you have to think about and what are all the little things you got to check off in order to have a safe BBL. All right? Because back in 2017, and before, the mortality rate for the BBL was extremely high for cosmetic surgery. It's 1 in 3,000. For cosmetic surgery, that was way too high, okay? So a whole bunch of studies started looking into it. Why is this happening? And it was found out that it has a lot to do with the anatomy of the gluteal muscle, okay? The muscle in the buttock region, all right? And what we found out is that deep to this muscle, there's these very large vessels. They're called the superior and inferior gluteal vessels. And what happens is that if you injure this vessel and fat gets inside the vessel, it pretty much has a straight shot from the buttock to the lung. Clogs up the lung, and then you die. And the death is almost instant. Okay? And so what was figured out was that in order to avoid these vessels, then you should not be placing fat into or deep to the muscle. Before 2017, it was taught that you should place the fat in the muscle because it has a better survival rate and because you can get more fat in. And in that point in time, people were wanting very, very dramatic hips and buttock. Okay? Of course, things have changed with the times, but that was what was going on. And then we found out, well, we can't do that. And so all the big societies, especially here in the US, the American Society of Plastic Surgeons and the Aesthetic Society, then implemented certain guidelines as to how to perform a BBL. And the study was repeated 2 years later, 2019. In 2019, when surgeons focused on just putting the fat in what we call the subcutaneous plane, or the space between the skin and the muscle, well, we found out that the mortality rate then all of a sudden went way down to 1 in 14,000 or 14,500. This is very similar now to a tummy tuck. That's about the same rate as a tummy tuck. So now it becomes about equal with all other very accepted cosmetic procedures. But we want to take you one step further, right? You don't want to just stay there, okay? You want to make this the safest procedure possible. That's what we've done here with my influence in pure plastic surgery and also the society of which I'm the president of, which is WAGS, the World Association of Gluteal Surgeons. So if you look at the World Association of Gluteal Surgeons, these are all highly experienced surgeons in this procedure who all do subcutaneous fat transfer for the BBLs, okay? the mortality rate for our group, members of WAGs, is 1 in 26,000. Even better than a tummy tuck in most procedures. And then what we found out recently is that if you're a WAGs member, so this is now WAGs, this is today, WAGs, today, and that data has been published, by the way, you can look it up. If you're a WAGs member and you use ultrasound, which is what we recommend for all of our surgeons to do, then that mortality rate goes all the way down to 1 in 50,000, which is similar to just liposuction. Okay? And this, my friends, my pure friends, if you guys saw our new little project there, my pure friends, this, my pure friends, is where you want to be. So I'm going to teach you what are the principles to make sure that you're getting a BBL that has a 1 in 50,000 mortality rate.
Who's the president of WAGs?
That's right. I'm the president of WAGs. That's right. I'm the president of the World Association of Gluteal Surgeons. And this is our focus. This is our goal, is to create a safe BBL. Because when done correctly, the BBL can be safe. The problem is that it's not a very forgiving surgery. So if you do it incorrectly, then it can become very unsafe. So that's why you got to go to the right person, right? You got to go to a surgeon that has experience, a surgeon that is board certified in plastic surgery, right? Not in anything. You don't want to go to a pediatrician. You don't want to go to a gynecologist, right? Because you want to go to someone that's certified in the procedure that you're going to do, right? I'm not going to go to a pediatrician to get my heart surgery done. So why would you go to a dermatologist or a pediatrician to get your BBL done? It makes no sense. Okay? So this is where you want to be. And so what are the principles? Well, number one, the experience of the surgeon. Studies have shown that surgeons that have done less than 50 BBLs are a lot more dangerous. Okay? In that 2017 study, most of the deaths that occurred were in surgeons that have performed less than 50 BBLs. So you don't want to go with a surgeon who's done less than 50 BBLs. You want to go to a surgeon who's done certainly more than 50 BBLs. And I'm talking unsupervised, right? For example, when Dr. Vidal came to Pure Plastic Surgery, she had just graduated from her residency program, and she had done maybe a couple BBLs. Well, her first 50 BBLs that she did here at Pure, she did them with me. And that's how you train up. Because you may ask the question, well, how do you go to any surgeon who's just starting? Well, that surgeon shouldn't be doing it on their own. They should be doing it with someone who's an expert, who's supervising them and guiding them and teaching them. By the way, do you know that we're a training center here? Pure Plastic Surgery is a training center for how to perform a safe ultrasound-guided gluteal fat transfer. We teach surgeons from all over the US and the world on how to perform this technique. Okay? So, you want to go to someone who's done more than 50 BBLs, ideally someone who's done thousands. I've done 3,000 BBLs in total and now over 2,000 ultrasound-guided BBLs. I've been doing ultrasound-guided BBLs since 2019. I'm one of the first surgeons to start doing this. Now it's actually a law in Florida after the experience that we've had showing how you can get to much less mortality when you do it this way. Okay? So ideally someone who's done thousands of BBLs is where you want to go. You want to go with a surgeon who of course really knows their anatomy, who really knows how to stay in that subcutaneous plane, that plane between the skin and the muscle, and who knows about where these large vessels are located, the superior and inferior gluteal artery and vein. Okay? Not only experience, you want to go to someone who is board certified, like I just said. Board certified by the American Board of Plastic Surgery. Okay? Next is technique. You want to make sure that whoever you go to does a subcutaneous BBL only. Strictly. Okay? We're not putting fat in the muscle. We're not putting fat deep to the muscle. Doesn't matter how dramatic you want to be. It's not worth your life. Like, remember the first questions we asked? If you want a more dramatic look, then it may take more than one round. But guess what? You're going to survive both rounds, right? Because we're putting the fat in the subcutaneous space, and we can build from one round to the other. But what you should never do is say, oh, I just want to do it all in one round. I'm going to go to a surgeon or a country where they put it in the muscle, because then you're down to here, you could potentially die on the spot. Don't do that. It's not worth it. Do not play Russian roulette with your life. Okay? So, subcutaneous space only. All right? There are other techniques which help you stay away from these vessels. If you know the anatomy, you know that there's these proper angles that you should take with your cannula, which is the long device that we use to place the fat. Proper angles that you should take with the cannula so that you are not in the vicinity of these vessels. Okay? But we want to take it a step further because, you know, one can have a lot of experience, one can have a lot of feel, but essentially if you're not using an ultrasound, it is a blind procedure. So why not turn a blind procedure into one where you can actually see, right? And that's the whole concept of the ultrasound imaging. Like I said, I'm one of the pioneers in this technology. We've been using it since 2019, done over 2,000 ultrasound guided BBLs and have had zero fat embolism, zero death, okay? So the whole concept is that we're using the ultrasound to create an image where I can see exactly where my cannula is, and I can make sure I'm in that safe space between the skin and the muscle, okay? And so you gotta use that ultrasound imaging whenever you're placing fat anywhere over the gluteal muscle, which is like the gluteus maximus, the big muscle back here, okay? This is a non-negotiable. If your surgeon doesn't use ultrasound imaging for fat placement, do not go. Okay? Non-negotiable. Ultrasound imaging for all your BBLs, and all of our WAGS members now do ultrasound imaging. All of them, 100%. Okay? Next is volume. There's been studies that have shown that if you do more than 3 BBLs a day, there can be something that's called surgeon fatigue. And when you have surgeon fatigue, you can make more mistakes. So do not go to these high volume budget clinic centers just because you can get a cheap BBL for $3,500. You know how they can afford that? By a surgeon doing 10 plus BBLs a day. Well, guess what? If you're lucky to be one of the first 3, maybe you're okay. Well, if you're number 4, 5, 6, 7, 8, 9, 10 plus, there's going to be surgeon fatigue, there's going to be mistakes, bad things are going to happen, there's perforations, there's fat embolism, there's death. Okay? So, I do not recommend going to a surgeon that does more than 3 BBLs in one day. Alright. Facility. The facility where you're going to is also very important. What is the reputation of the facility? What is the complication rate of that facility? Who has certified that facility? Okay? Facilities have different degrees of certification. For example, here in Florida, the kind of lowest level or baseline level, I should say, certification is that by the Department of Health, right? If you don't have that, then you can't operate. You're doing illegal operations, illegal surgery. So that's the baseline. You have to have Department of Health. You have to have that. Then there's a couple more categories where you have more and more strict guidelines as to how to do things and how to do things safely for your patient. There's, after that, what's called Quad ASF. And then the highest level, this is like the highest level, which is equivalent to what they do for all the big major tertiary and quaternary major hospitals and centers of excellence, is what's called the Joint Commission, or JACO. Okay? Can you all guess what certification we have here up here? Of course. Here, you know, we don't just talk the talk, we walk the walk. We go the extra step, we go the extra mile, and we get the highest level of certification that you can get for an office-based surgery setting, which is JACO. So JACO, we are JACO certified here at Pure. Okay? So you should ask the facility where you're going to, well, who certifies you? Is it Department of Health? Is it Quad ASF, excuse me? Is it JACO? Okay? Look at the history of the facility. There's facilities out there that are operating today that have had not just one death and complications, multiple deaths and complications. And they're still out there functioning, and people still go there. Why? Because they're cheap. Okay, it's not worth it. Look at the complication rate of the facility. Look at how many BBL deaths. Okay, you don't want to go to a facility that has any. All right. Now, oh, I brought a little show and tell. I forgot. This is the ultrasound. It is super easy in terms, it's no longer this huge machine that costs hundreds of thousands of dollars. It's light. It's easy to move around. It's portable. From here, it transmits an image to an iPad, so you can move it from OR to OR, place to place. Okay. The device is about, very accessible to a surgeon, about $3,000 or so. So there's no reason why a surgeon should not have this. Okay? At WAGS, we've developed a program to demonstrate proficiency in doing ultrasound-guided BBLs. All right? And so that program entails going through, several hoops to make sure that you know what you're doing, that you know your anatomy, you know how to use the ultrasound, that you're in the safe space. So what does that involve? It involves first reading online articles, giving you all of the information and anatomy, and then taking an online written test. And then after that, you're going to watch a video of an expert doing the procedure, so you can get the visuals. And then after that, you're going to come to one of our training centers. Pure here was the first one. And we also train the trainers of all the other centers. Okay? So you're going to come for the training center where you're going to spend a day there. You're going to go again through some didactics, and then you're going to watch the trainer do the procedure in person inside the operating room. And then you're going to get to practice with some different models like on the counter. Okay, showing you exactly how to use the ultrasound, how to see the cannula and all that. Okay, and then you'll get a certificate for that. And then you're going to go home or to wherever you do your surgeries, and then you're going to perform the surgery and get a video of you performing the surgery, sending that to WAGS so that we can then make sure that you're doing things correctly. All right? So you got to go through all these steps, and then we are able to then provide the WAGS safety seal, which you can see here. Okay? So this is the World Association of Gluteal Surgeons safety seal, for ultrasound guided BBL. Okay? Certified, of course I am. I was number one, right? And the creator of the program, along with the other leadership at WAGS. Okay? And you can see that we're doing safety in BBL since 2019, as it says right here. Okay? So, I would ask this question of your surgeon, do they have the WAGS safety seal for BBL? If they have that, well then you know they're using ultrasound, you know they have great technique, you know they have experience, because we've vetted them for you. Okay, we've done a lot of this homework for you. Okay? And then the next thing that we're developing, and this is in the works and hopefully we'll be done developing this program before the end of this year, is we're going to be developing the Centers of Excellence for BBL Safety, for BBL and BBL Safety. Okay? And we're already developing all the criteria for these Centers of Excellence. And therefore, you're going to know that if you go to a WAGS Center of Excellence for BBLs and BBL Safety, then you know that the facility has been vetted specifically for this procedure. And that's going to be our next step, so really to keep an eye out for that, because we're creating this Center of Excellence certification as we speak. Okay? All right. A lot of information, a lot of great information. Please take a screenshot. Screenshot this, okay? So you can have it with you. And I'm happy to answer any questions you may have.
Okay. The screenshot time is over.
All right. There you go.
Okay, first question, Doc. Okay. How long should I take off work for a BBL?
So that's going to depend a little bit on what type of work that you do, okay? But if you are like in an office type setting, then usually, 2 weeks will certainly be enough. You can go back to work. You just won't be able to sit directly. You have to take your BBL pillow or get a standing desk, okay? But if you have a job that requires physical activity, such as a lot of our nurses, our police women, men or women, and our firemen or firewomen, that's going to be 6 weeks.
Okay. Is an ultrasound needed for breast lift with implant?
No. So you don't need an ultrasound for that. That's what I would call it an open surgery, right? It's not a blind surgery. When you're doing the implant, you're directly visualizing the pocket for the implant. And when you're doing the breast lift, you're directly visualizing everything. It's kind of opened up at some point before you put everything back together. So it's open surgery, right? The key, the reason why you need it for this is because it's a blind surgery originally, right? If you didn't have ultrasound, it would be a blind surgery because you're making this little tiny stab incision and you're putting this long cannula through there and you can't see exactly where that cannula is. You can feel, you have an experience, but now with the ultrasound, then you can see where that cannula is going to make sure it's in that safe space.
Question and Amelie.
Amelie, yes.
Any scars after procedure since you have to cut in the skin?
Okay, so first of all, who knows what Avali is, right? So Avali is a device that we use for cellulite. We're super excited about it. We've been doing it for over a year now. We're actually a training center for Avali as well. And we are the #1 Avali provider in the entire East Coast. Okay? So we have the most experience with the device. It's a device that's used for cellulite. It's the only thing out there that works for cellulite. Creams don't work. Injections don't work. The only thing that works is Avali because it goes to the root of the problem. It cuts the bands that are pulling down the skin, creating that cellulite dimple. If you want more information about cellulite and Avali, please look at some of our lives that we have already on our YouTube channel. Go to YouTube, Pure Plastic Surgery, and you'll find an entire live regarding this, okay? So, regarding the Avali, what was the question again?
The scarring? Scars?
Scarring, yes. It's all done through tiny, tiny incisions. So, is there a scar there? I mean, anytime you make an incision, there's going to be a scar. But I'm telling you, it's like 2 millimeters. It's extremely small, pretty much not visible.
How long after a BBL can you sit?
So, for direct sitting, it's going to be 6 weeks. So, no direct sitting up until 6 weeks. Before that, you're going to have to use a special pillow. It's called a BBL pillow. And you can get these pillows, you can get them online, you can get them in certain stores, we can point you in the right direction. But before the 6 weeks, you'll just use the BBL pillow. And so you'll use that, of course, when you're like in the office or whatnot, but also for driving. You can use the BBL pillow when you drive, and you're going to use your BBL pillow when you fly back home if you're coming from out of town.
Okay, this is not a question. It's a message from a patient that had Avali.
Yes.
She said, no scarring.
Right, there you go.
And also she said, Dr. Earl is great. He took away almost all of my dots completely.
All right. Yes. Thank you. Avali, it's a great device. If you have cellulite, it's the only thing that works. Please, reach out to us and we'll take care of it.
Okay. Is there any age limit for a BBL or any safety concerns?
Right. So actually, that's another thing, and maybe I probably should have put that here as well. So that's a great. Thank you for asking that. Criteria. I don't know. I'm gonna kind of fit it in here. The patient criteria. That's a great question. And honestly, I totally forgot to put it up there. So, is this a procedure for anyone? The answer is no. Okay. Obviously, first of all, you have to be healthy. So you can't have a whole lot of other medical problems, certainly not active problems. You have to be generally healthy. So we're going to check that. We're going to check a whole bunch of labs. And we're going to make sure that we're going to look into your past medical history and your past surgical history. In terms of the labs, one of the most important ones is your hemoglobin level. That's kind of the amount of blood that you have, right? Your hemo level needs to be 12 or above in order to perform this surgery. Okay, we found that for our patients historically, they have a hemo level less than 12. The chances of needing a blood transfusion are pretty high, even with the cell saver. Even with the cell saver, which we do for all our patients. If you have something like diabetes or high blood pressure or thyroid issues, they have to be controlled. Okay? And then in terms of age, I have an age limit, upper age limit of 50. I've found that patients that are over 50 years old for this particular procedure, they tend not to do well. They kind of decompensate. They have a higher chance of ending up in the hospital for either hydration or blood transfusion. And also their skin doesn't tend to retract very well, and sometimes it ends up being all like wrinkly or lumpy bumpy, and they're unhappy with that. So I have an upper age limit of 50 years old. And then the last, but certainly not least, is your BMI. We all know that the higher the BMI, the higher the complication rate. And so I put a limit, my BMI max is 30. Okay, once you get to 30, the complication rates, once you get above 30, complication rates start to go up kind of like exponentially. I certainly wouldn't recommend, no one in the world anywhere should be doing a BBL on someone with a patient has a BMI of 35 or above. I think that's just wrong. Like don't do that. It's a non-negotiable. I would not do a BBL on someone with a BMI over 35. The same way as the ultrasound imaging. You should not be doing BBL without ultrasound imaging.
Okay, how many fajas will I need to buy?
So you're gonna have to buy at least 2, maybe more. Okay, but certainly no less than 2. You're gonna start off with the stage 1 faja, which is the one that we provide for you if you're coming here at Pure. And that one is actually just for the first week or so. That one is not as tight. That one, you don't want it to be as tight because the skin just went through, through the surgery. And so we don't want to, the skin basically got beat up, and you don't want to be too tight in the skin initially. Now, after about a week, if everything's looking good and the skin look good and everything's okay, then you can switch to your stage 2 faja that's going to give you that nice tight compression. Now, there's some patients that then either have to have their stage 2 faja altered because their swelling and everything has come down. So you can either then alter your stage 2 faja or go ahead and get a stage 3 faja, which is going to be even tighter compression.
Doc, there are many questions about the breast implant illness. I think we have a live.
Oh, okay. So I'm just going to give a short answer now, but we should definitely go to our YouTube channel, Pure Plastic Surgery, and you'll hear, I believe Dr. Vidal has done a great live on breast implant illness, and I should definitely watch that, okay? Breast implant illness is what some people say, or the symptoms they start to develop, they believe, due to the breast implants, okay? These symptoms are very similar to those of people that have autoimmune diseases. Sometimes they describe like fogginess, or not being able to concentrate, just feeling like, like down or depressed, low energy, things of this nature, okay? Now, the thing is, there's been many studies done on this, many studies, okay? And no study has been able to basically indicate that the implants are what are causing the symptoms, right? In fact, the official standing of the American Society of Plastic Surgeons and the Aesthetic Society is that there's not enough data or evidence to prove that breast implant illness actually exists, that the symptoms are being caused by the implants, okay? One of the corollaries to that is that if this were real, then those patients that have these symptoms, once you remove the implants, they should get better, right? But it doesn't happen that way. Some of them might get better, some of them don't. Okay, so that's the stance right now. But if you want a really detailed kind of talk about this, go to our YouTube channel. You'll get a nice detailed 30-minute talk on this subject.
Should I get Avali before BBL or at the same time?
Good question. So you can, ideally you would get it, up to 6 weeks before your BBL, or you can also get it 3 months after your BBL. Okay, once you've healed from the BBL. It's quite rare that we do it at the same time. That's only for very few patients where they have only a small amount of very discrete lesions. Okay, so if you have maybe up to 3 kind of well circumscribed discrete lesions per side, then that's the type of operation that we can do at the time of the BBL. But if you have a lot of cellulite, multiple cellulite throughout the buttocks, throughout the thighs, then it's best to stage it, and then you can do it either way. You can do it either 6 weeks, or before the BBL, or 3 months or after the BBL.
I like this one.
Uh-huh.
But yeah, after a skinny BBL, if you lose a lot of weight, but then again gain, will you gain in the areas of fat transfer? Sound like a trabalengua.
So skinny BBL, and then you lose weight.
Correct.
So you're skinny to start, now you're losing weight, and then you gain it back. What happens? Okay.
Correct.
So so this is what's gonna happen. If you lose the weight within the first 3 months of getting your skinny BBL, you're gonna lose that fat forever. Do not do that. Say you started skinny and you have to gain weight for your BBL. All right, well that now is your new baseline weight. You have to maintain that baseline weight at the very least for the first 3 months after your surgery. Ideally forever, but for the first 3 months, you gotta maintain that weight. All right, but say you did the right thing. You maintained the weight for the first 3 months, and then you lost weight. Well, that fat now should be basically permanent fat in your body, and so then if you gain the weight back, it should come back in those areas. All right, that's it. 30 minutes. All right.
32?
32.
Yes, sir.
Okay. Awesome. All right, everybody. So once more, this is what the ultrasound looks like. This is what we use for every single BBL. This is what every surgeon that does a BBL should be using. Okay? It is the non-negotiable here. Okay? All right.
Well, but we can leave without saying, hey, go to our website, virtual consultation.
Oh, of course, of course.
Okay.
All right, but before that, once again, the WAGS, World Association of Gluteal Surgeons Safety Seal. Ask if your surgeon has this. That means that we have vetted them already for you. We know that they are safe. We know that they have the experience, the technique, the criteria, the ultrasound, they control their volume, etc., etc. We've done the homework for you. Okay? So ask about this. If they have this, you know you're in good hands. All right? Coming soon, the Center of Excellence. Perioplastic surgery is probably going to be the first one, of course. And we're going to be then basically explaining all the criteria for the WAGS Center of Excellence for BBLs and BBL safety. Okay? Now, if you want to have a consultation, remember that we accept patients from all over the U.S. and international. We did a live, was it last week? We've hit 49 states and what was it, like 38 countries?
38 countries.
Yes, and 38 countries.
And 257 cities.
No, 700 and something cities.
Okay.
Yes. All right. So that means that we do a lot of virtual consultations. All right. So in order to do that, go to our website, www.puroplasticsurgery.com, and hit the button that says start your journey or book now. Okay. And then you're going to go to our virtual consultation form, and there you can fill out the questionnaire. You can send your photos. That's going to go to our patient care coordinators here. They're then going to reach out to you. They're going to call you. They're going to go over all your goals and expectations. They're going to answer all your questions, and then potentially they'll be able to book your surgery, give you a quote, book your surgery, get your date, etc., etc. Okay? Now, some may be asking, well, what happens if I want to do a video call or come in person? Hey, we do that too, all right? But the easiest way to start is with the virtual consultation on the website. Put in your information. Once you get the call from the coordinator, then if you want to do a video call with me or come in person, she'll be able to set that up for you as well, all right? Okay, all right, everybody. Well, that's it for today. I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. Ciao.